Hello and welcome back. I'm Stephanie Michael, speech language pathologist for LUCDA, and today we're going to talk about the sound K and G. So let's talk about the placement of the K and the sound G. Both of these sounds are made in the back of our mouth. K, k, g, g. So I want you to feel that. I want you to make those sounds and feel those sounds in the back of your mouth. And g, g. Now, most of your children, what they are producing instead of in the back of their mouth is they are bringing their tongue tip forward. So they're producing the T and the D sound. T, t, d, d. Those are the sounds that your child you are substituting for the K and the G. So for instance, instead of saying cow, your child is producing the word tow, or dough for go. So what we need to do is we need to teach your child to bring that tongue tip from going up to bringing it back. The first thing that I always start with is making sure that your child is able to hear the difference between the k and the t sound. So what I would do is I would start having your child be able to identify where the k sound is in a simple game. Something like this. Okay, I want you to listen for the k sound. It's either going to be on this hand k, or this hand k. Let's try. T, k, k, t. And then your child is going to hit the hand where they hear the k sound. So let's talk about also the difficulty for your child at times to be able to bring that tongue tip down. So I have a couple of techniques that I use to help your child be able to make the placement of the K sound correctly. The first technique that I tried to do is I grab a sucker and I actually take a sucker in my hand and a sucker in your child's hands, and we hold our tongue down and we go k, k, k. So the child actually has to physically hold that sucker on the tongue to be able to make that sound. I've also even just used our fingers. So make sure your hands are clean, and also your child again will have to hold that tongue down. At times you may have to model that for your child and hold the tongue down yourself. I've also used tongue depressors to make sure. But the main thing is hopefully we can get your child to do that independently so they can start feeling that vibration in the back of their mouth. Now, some of your children actually can produce that sound in isolation. And by that, I mean they're able to produce k. But when they're putting it into words, they may go k, k, tow, which is typical for kids just learning the placement for this sound. So what we have done is in your packet, we have sent home some K and G cards. They're going to look like this. We're going to give you multiple cards so you can cut them out and make several cards for your child. Now in another video, I will give you some ideas of games that you can use with these cards. In your packet, we've also given you more than just cards. We've given you sentence cards. So for example, it says Kim cooked the, and then your child can come up with a word to make that sentence. We also then included sentences that have a lot of the K sounds. So this gives you kind of a recipe card to help work with your child on completing full sentences with that sound. We understand that every one of your children are at a different level. That is why we have included different levels of articulation cards in your packet. So to recap, with the sound K and G, those sounds need to be produced in the back of the mouth. And I've given you some examples of how to help manipulate your child's tongue. If you have any questions, please don't hesitate to call your local child development center for more information.